The Philippine Daily Inquirer would like to thank the following sponsors for making this live stream event possible. Globe. Konsulta MD. Ikonsulta mo na yan. MaxiCare. Live your best life. Medicard. Prescribed by doctors. We'd also like to thank Inquirer.net, Mega Mobile, and Inquirer Academy. We'd also like to acknowledge the organizations that have partnered with us. Thank you to
For me to take good care of my daughter, kailangan ko rin syempre ingatan yung sarili ko. Ngayon, isasama ko kayo sa first time kong pag-visit sa MaxiCare Primary Care Center.
Super convenient talaga magpa-check up dito sa MaxiCare Primary Care Center. I feel safer here and I love the ambience kasi pagpasok mo sa loob, para ka lang nasa hotel lobby. So I'm encouraging you guys to get a MaxiCare healthcare plan. And if you're already a MaxiCare member, visit the nearest Primary Care Center branch in your area.
All the way from LA, Curtis Smith. The one and only. Ben. Trending on Twitter right now! Woo! Congratulations to everyone.
And don't forget to download the Konsulta MD app. Super easy and there's free mental health consultations 24/7.
Yes, till October 31. It's free, guys, free. She needs no introduction. The one and only Nadine Luce.
Come on and make me say,
Let's all help raise awareness for mental health. Good night, everyone.
Pagkatapos ng trabaho sa bawat araw, ang gusto lang natin ay makasama ang mga mahalaga sa atin. Pero minsan, may mga pagkakataon para ipakita sa iba na mahalaga rin sila. Kahit gaano pa kahaba ang araw natin, kahit gaano tayo kapagod, meron pa rin tayong panahon para tumulong sa iba. Salamat sa mga taong katulad nila.
Good afternoon, everyone. Thank you for tuning in to the Inquirer Project Rebound webinar series presented by the Philippine Daily Inquirer. My name is Doris Dumlao-Abadilla, features editor of Inquirer Business, and with me is Dax Lucas, news editor of Inquirer Business, who will be my co-moderator for this live stream event. The Philippine Daily Inquirer and its sister companies introduced this campaign last year, prompted by the desire to share, inspire, and empower Filipinos. Now, on its second year, we are leveling up and drilling down on key sectors that will be crucial to the Philippines' continued recovery from the twin public and economic crisis brought by the COVID-19 pandemic. Let's watch this.
So today we are kicking off the new series with an in-depth discussion about the healthcare industry. The pandemic has put healthcare at the front and center of technological advancements and policymaking, pressing economies globally to fast-track the development of crucial innovations that will beef up their respective systems to respond to Filipinos' needs and at the same time, take advantage of the lucrative opportunities that have inevitably opened up. We will have an open Q&A segment later for our speakers to answer whatever burning questions you have about the future of healthcare. So please do leave your questions or feedback on the comment section of this webinar's live stream on the Project Rebound or INQUIRER.net pages. Alam mo, Doris, you'd think that after over 3 years of talking about health and healthcare, interest would wane, but it's as relevant as ever, no?
Yeah, and especially now that we're opening up, and yet we know that the virus is still there, and our topic is very timely because we should learn how to better live with the virus.
That's right. So
Have you been going out? After 2 years, it's only now that I've gained confidence
Konti
to
lang.
go out. So before we introduce our guests, we would like to give an exclusive offer for our viewers. You can get a free 30-day trial of the Philippine Daily Inquirer's digital edition, Inquirer Plus. We're flashing the details on your screen so you can see how to get this free trial. You can also visit shopinquire.com.ph to know more about Inquirer Plus.
now it's time to introduce our esteemed guests for today's session. Our featured thought leaders in this webinar entitled Healthcare, What Lies Ahead Post-Pandemic will delve into the future of healthcare and how the pandemic has changed the sector and how the industry will look over the next few years as the country emerges from this public health crisis. Our first speaker is very famous by now, Dr. Maria Rosario Singh Vergeire, who will be sharing a pre-recorded message on living with COVID-19. Dr. Vergeire is the current Undersecretary for the Public Health Services team and the official spokesperson of the department. She was previously OIC Undersecretary for Health Regulation Team and Assistant Secretary in charge of the Public Health Services team. She also acted as OIC and Deputy Director General of Field Regulatory Operations of the Food and Drug Administration, Office Director of the Health Facilities and Services Regulatory Bureau, and Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Undersecretary Vergeire has committed decades to public service, having worked in Marikina City's health office before joining the Department of Health in 2007. Aside from public service, Dr. Vergeire is also committed to nurturing our soon-to-be public health leaders, serving as faculty at the Development Academy of the Philippines and part-time faculty at the Ateneo School of Government. She has obtained her undergraduate degree in zoology from the University of San Tomas, her MD from De La Salle University College of Medicine, and her MPH from the University of the Philippines, Manila. Let's watch this.
On behalf of the Department of Health, I would like to extend my appreciation to the Philippine Daily Inquirer for providing us a platform to share and discuss the different measures of living with COVID-19. This will be the outline of our discussions for today. To begin, let me give everyone a brief overview of the current situation of COVID-19 in our country. We are seeing a continuous decline in the number of cases of COVID-19 in our country. The average number of cases from April 14 to 20 have gone down to 236 cases per day, which is 11% lower than the previous week's average number of cases. With the decline in our reported cases, our healthcare system's capacity is also at low risk. With the continued decline in cases and low-risk healthcare system capacity, let us look at the strategies and guidelines moving forward. Recognizing that defeating COVID-19 necessitates a response continuum, we have adopted the prevent, detect, isolate, treat, and reintegrate strategy, which remains to be the cornerstones of our national COVID-19 response. Immunization remains to be one of the most essential public health interventions to defeat a pandemic. However, it is also inevitable for us to continuously readjust our strategies as we marvel on the road towards the new normal. Before 2020 started, we did not know what COVID was. Now we can do genetic sequencing and have many studies going on at the same time. Before, no one had immunity from COVID-19. Everyone was at risk of severe disease, especially the elderly and those with comorbidities. Now, many of us have immunity from severe COVID-19 and deaths because millions of us had been vaccinated already and some have recovered already from COVID-19. At the start of the pandemic, we did not know what medicines worked when COVID-19 disease progressed. Now we have more and new drugs being developed and studied, including drugs that can be taken to prevent disease progression. Most importantly, the available vaccines that we continue to give to the public have helped us turn COVID-19 into a manageable outpatient disease. The road to easing restrictions towards a new normal has to be a balancing act. When we say adapting to the new normal, our strategies on reintegration do not solely involve the efforts made to reintroduce an individual to a society, but also focuses on allowing the whole population to adapt to the new normal. The safe reopening of the Philippine economy will be vital in addressing the enormous revenue loss brought about by the pandemic. This encompasses promoting economic activity while mitigating the risk of disease transmission and with emphasis on the adherence to the minimum public health standards. As the number of individuals getting fully vaccinated increases steadily, easing of public health standards for fully vaccinated individuals is also being discussed with our experts while ensuring that the population is protected from any emerging risk. Likewise, a phase type easing in the use of personal protective equipment may be considered. To provide cumulative protection, we have different layers of interventions. At the individual level, protection is provided through COVID-19 vaccination, which protects against severe disease and death. Appropriate and well-fitted PPEs also include added barriers to infection. At the level of the workplace, we recommend alternative work arrangements if applicable, reinforce the roles of safety and surveillance officers to ensure the application of our PDITR strategies in the workplace. In our households, we can also have that layer of protection by ensuring that people we are usually in contact with are vaccinated. Also ensuring household disinfection and minimum public health standards implementation at home remains important strategies for reducing infection. And finally, at the level of the community, we must ensure that the most vulnerable and exposed are protected because they are the groups that also demand healthcare to be admitted in our healthcare facilities. As we transition to the new normal, there would be needed transitions to be undergone by our healthcare facilities as well. To guide our planning, we define the scenarios of the endemic and transition phase. In general, we see a transition into a COVID endemic phase for our healthcare facilities. From a pandemic phase, which requires COVID-19 dedicated beds in all hospitals, we shift into the transition phase, where only selected government hospitals will be required to dedicate beds for COVID. Finally, we are looking at an endemic phase wherein dedicated COVID beds are no longer required, just like what they have planned in Singapore, and we treat COVID just like a seasonal flu, measles, and any other infectious diseases whose infected patients shall be admitted at any healthcare facility following infection prevention and control measures in place. For the temporary treatment and monitoring facilities, the repurposed structures such as schools and stadiums will be reverted back to its original purpose. Before we end, let me give you a glimpse on how we envision having healthy settings in the new normal. We will continue to reiterate that behaviors are key to achieve good health. The healthy settings approach is an important strategy in ensuring the uptake of healthy behaviors. It offers opportunities to mainstream health and keep health top of mind by reaching Filipinos in the settings of their everyday lives. That would be at home, in school, and at work. Ensuring improved access to safe and nutritious food with clean, potable water, opening up public spaces and varying infrastructures which promote active mobility, physical activity and leisure, and safe road use, making sure that our environments would have hand washing stations and proper waste management systems, warranting that housing conditions are made affordable, accessible, and livable, providing more smoke-free, vape-free, and drug-free environments to allow a more conducive environment for healthy growing and aging, ensuring that Filipinos earn a reasonable wage in an environment that also takes into consideration their physical and their mental health, making neighborhoods safe from violence and neighborhoods that are inclusive and harmonious across all ages, genders, sexual orientations, and social status, and strengthening local health systems to be more responsive and improving the availability and accessibility of essential health services among communities. Our standards of how we run our offices or businesses needs to be revamped in order to appropriate the change we want to see. Ensuring healthcare is provided through managed care and health commodities by the employers, and strengthening linkage to local health system and services for appropriate management. The new normal refers to emerging behaviors, situations, and minimum public health standards that will be institutionalized in routine practices and will remain after the pandemic. As we usher into this new normal, we continue to remind everyone about the importance of the minimum public health standards and vaccination. Let me end my presentation with this reminder to all of our kababayans. COVID-19 might be here to stay, but if we work together and act on our roles, we will all become contributory agents in reducing the impact of this virus, and we will all be able to continue our overarching purpose, that would be to be of service to the nation and give service above ourselves. The Department of Health will continue to be your ally in serving other people and in changing the lives of our Filipino communities. Thank you for listening, and good day to all of you.
Thank you, Dr. Vergeire, and to the Department of Health for the insightful presentation on how we could shift from pandemic to endemic management. Dr. Vergeire actually sent us a 20-minute presentation, and if you want to watch the full version, it's available in the INQUIRER Project Rebound YouTube account. Before we move on to our next speaker, please be reminded that they will attempt to answer questions you have on the future of healthcare. So please do comment on this webinar's live stream on the Project Rebound or Inquire.net pages.
Okay, our next speaker is Dr. Rajendra Prasad Yadav, the acting World Health Organization representative to the Philippines. He is also the team leader for disease programs, universal healthcare, and medical officer for tuberculosis. In addition, he has been supporting the country's response to the COVID-19 crisis. Dr. Yadav has been a medical officer at the World Health Organization since 2004. He has worked in this position in Papua New Guinea, Cambodia, and the Philippines since 2016 onward. Before joining the WHO as a staff member, Dr. Yadav was a medical consultant at the WHO in India from 1999 to 2004. Previously, he was a lecturer at the Department of Preventive and Social Medicine of SETGS Medical College and KEM Hospital, Mumbai from 1992 to 1999. Dr. Yadav is a medical doctor specializing in preventive and social medicine. He completed his medical graduation and post-graduation in SETGS Medical College and KEM Hospital in Mumbai, India.
Good afternoon, Dr. Yadav.
Good afternoon. I'm glad to be here. I have a few slides to show. Thanks to the Inquirer team for inviting the WHO to present. As Dr. Rosette from Department of Health mentioned earlier, whether we go towards a future of happiness or continue into a future of sadness depends on what we do now in the present. So the pandemic is definitely not over yet, but we can all put our efforts together to end it as quickly as we can. As my super boss, Dr. Tedros, who is the WHO Director General in Geneva, he mentioned recently, this virus won't go away just because countries stop looking for it. It is still spreading, it is still changing, and it is still killing. So countries are now testing less and less. And we see reports that such and such place had 0 COVID cases for the past 1 week. We should not be misled by data. Yes, the number of cases are very low, the number of deaths are very low, and we are moving in the right direction. But if we relax at this stage by saying that there is no COVID anymore, that may discourage people from using masks, that may discourage people from getting vaccinated or getting boosted with the vaccines, and that would not be good, and we'll go back to what we were in the past 2 years. So Dr. Tedros also mentioned, as many countries reduce testing, WHO is receiving less and less information about transmission and sequencing. So to a certain extent that is alarming. Of course, we cannot keep testing in the huge numbers that we were testing in the past few months, but we have to do smart testing, particularly testing the high-risk groups. And then we have to monitor the trends in those specific groups. Just avoiding testing or not testing and then using that to say that we don't have COVID anymore, that's not a good idea. So, as also Dr. Tedros mentioned, it is too early to declare victory over COVID-19. So, as I mentioned earlier, we are moving in the right direction. We have to keep doing the right things. And what are those right things? These are what I call the 3 lines of defense. We have been doing that, and we have to continue doing that. The first line of defense is mask. They prevent infection. And Filipinos have been one of the most cooperative countries. Filipinos have been one of the most cooperative in the whole world for mask. More than 90% of the people were reported to be using mask a few weeks ago by one study. So that has to continue. We need to continue to wear masks to prevent infection. Second is vaccines. Vaccines may not prevent infection, but they prevent severe cases of COVID. And that's unfortunately, we have not reached the level of vaccination in the country that is required to say that we can now move into the post-pandemic phase. More than 2 million elderly people have not got even a single dose of COVID-19 as per Department of Health reports. And unless we vaccinate at least 70% of the population in each barangay of the country, we cannot say that we are moving into the post-pandemic phase, because when the next wave strikes, many more people will die unnecessarily in those barangays which have low vaccination coverage. And we know which barangays they are and where we need to focus our efforts more. And third line of defense are the oxygen and drugs. They prevent deaths. Of course, we should not have to reach that stage if we do proper masking and proper vaccinations, including booster doses. But if we do reach that stage, we should have adequate oxygen and drugs to prevent deaths. So we need to continue this 3 line of defense. Then we can move into rethinking, resetting, and rebounding for our future. So we should not go back to same old, same old. We have to build a new future that is brighter, better, healthier. For that, we have to rethink. This is the right time for the human race to rethink about, for example, what are our priorities? Where are the inequities? who are the people who are left behind all the time, whether it's in the COVID-19 pandemic or in terms of development. And we have to rebound as a human race together. And some of the things that we can do in the rebound phase is to focus more on self-care. We realized during the COVID-19 that if we over-rely on healthcare at the facility level all the time, then if a new humanitarian crisis or public health emergency strikes, then we'll be in trouble because the health workers will be repurposed for managing that humanitarian crisis. So we have to increasingly build the health literacy of our people so that they can self-care, including simple things like measuring their own blood pressures at a regular interval. Telecare, this is something that has taken, we are using this more and more, and that is very good. But of course, not everyone can do self-care and telecare for all diseases and all populations, and that's why the third one, outreach services. During the COVID-19, we realized that just sitting in the facilities and serving the people is not enough. We can only reach about 70% of the people for any program by serving them from the facilities. That is good. That has to continue. But for the remaining 30% of the unreached populations, we have to do outreach services. That way we can make them healthier and more resilient for facing any future pandemics. Another thing that we need to do is to continue work from home. So employers need to allow their workers to work from home. And even now workers are demanding that they want to work from home. Of course, in certain industries, we cannot work from home. We have to be at the ground level. So those industries where it's possible, we need to allow that, because that will help us to have more family time, more exercise time. Like for example, myself, I lost 10 kg weight deliberately, of course, and I could do 1 hour to 2 hour exercise every day because I could save time from the commute. So yes, we need to encourage that. But of course, now we are coming back to offices. So we have to balance both. Work from office is also fine as long as we can also have work from home. So flexi time, flexi place. And the last part is that we need to work towards cleaner air, cleaner water, and healthier food. We can do that by caring for our planet, and then our planet will take care of our health. This year, the theme of the World Health Day is Our Planet, Our Health. So now we are moving away from one crisis, the COVID-19, and we are continuing to face another crisis, climate change. So we don't focus enough on that. But unless we have unless we take care of our planet, our health will continue to suffer, not just because of COVID, but also other health ailments. Thank you.
Fantastic insight. Thank you, Dr. Yadav, for sharing your thoughts with us. Congratulations on losing weight. I wish I could do the same, but it's really worth remembering. Rethink, reset, and rebound going forward. Doris.
Thank you, Doctor. Yes. Our next speaker is a medical doctor and health systems consultant with more than a decade of involvement in supporting community health development in the Philippines. Dr. Mike Caampued. He currently sits as the founding board member and current president of the Philippine Society for Public Health Physicians, a partner for the NGO Alliance for Improving Health Outcomes, a faculty for the Development Academy of the Philippines, and an invitational subject matter expert for the Philippine Navy. He previously worked as a doctor to the barrio turned municipal health officer for the municipality of Polillo between 2010 and 2014, and was given the Grand Distinction Award by the Department of Health. Congratulations, Doctor. From 2014 to present, he has been involved across a range of country-level, regional, and local technical work on the UHC implementation, health financing, COVID-19 response, health strategic planning, health systems research, and organizing people-centered care integration. Good afternoon, Dr.
Afternoon.
Dr. Mike.
Ayan. Hopefully, I think I'm having some delays in my audio. But is that okay?
So far, so good.
All right. Okay. Thank you. Thank you for the generous introduction, and also thank you to the previous speakers for providing enough material for me to start the context of what I'm going to talk about. So, good afternoon to all our viewers here, and thank you, Inquirer, Philippine Daily Inquirer, for this project, and also for inviting us to speak. And also thank you and good afternoon to Dr. Raj and Ma'am Rosette, who are my dear colleagues in DOH and WHO. So, when I was invited to speak for this particular topic, which is digital health in the Philippines, I was actually thinking that maybe I would have to refer this particular topic to someone who has the specific expertise over digital health. My expertise in public health concentrates around health systems, integration, and also governance. But I took up the chance at least to kind of provide a lens that looks at the system around digital health in the Philippines and how I would probably advise or recommend ways to strengthen digital health systems and the digital health within the Philippines. And at least from the talks that were given by Yusek Rosette and also Dr. Raj, I think it's clear to us that the challenge is still there. The pandemic is still here, and that solutions have to be made continuously and with enough resoluteness to pursue still our desire for better health outcomes. So this material that I've assembled, next slide, please. Just some disclosures on the material. The opinions that I'm providing are not from my organizational representations, and the materials assembled are for the purpose of the discussion. No? And we've provided citations naman to the owners of the of figures and also information. So here, part of my exploration of how digital health is now evolving within the Philippines, there are several driving factors that we see. No? Firstly, the fragmentation and poor access, which is a pervasive problem. Alam naman natin no, na napakahirap ang access to care dito sa archipelago, which is the Philippines, and also the broad disparity in the economics and also the opportunities within our various localities. And the adoption of digital health solution somewhat provides us with some bridging mechanisms to actually bring services to where they are needed the most. Another push for digital health adoption is the increase in healthcare costs. So, within the Philippines, as we all know, there's an increasing health expenditure. And just last year, I know we've had a total health expenditure of about 1 billion. And still, we have a lot of out-of-pocket that's happening, about half. So 44.7% is still coming from the pockets of every Filipino. And that's concerning. And the government and the whole of society within the Philippines is actually trying to simplify its financing and trying to make sure that there are more efficient mechanisms of management and strategizing our investments, hence the adoption of digital health solutions. Another is the rising expectations. No, the rising expectation that Filipinos are getting savvier sa mga technologies. 73 million users of internet, and we have the rise in the telehealth industry. No, so like Globe Telecom having Konsulta MD and also Medgate last year. They've had an increase of about 1.5 million paying subscribers. Just because of this particular development. And also we have advancing technology, both domestically and also globally, where we see a lot of the emergence of health apps, mga Fitbit and all that, and also the apps that are actually supporting our health system solutions or hospital solutions. And there are more market players in the Philippines introducing technologies, and also globally there are emergence of more advanced advanced technologies like AI, machine learning. And another driving factor is the implementation of the UHC model of care. So kung sa mga hindi pa ganong nakakaintindi, no, the UHC model of care right now is trying to merge our municipalities into bigger health system units, which is provincial. Kasi we've pushed the disaggregation a little far. So with the proposal within the UHC law to merge them into provincial or citywide health systems, the intention is to have more integrated and more centralized management, and also the ability to deliver a fuller continuum of care and greater scale efficiencies of scale. So digital health solutions are also expected to support this, as well as the need for supporting a more personalized care approach or people-centered approach, and also accountable governance and multi-sectoral collaboration. And of course, all of these driving factors are even more amplified when COVID-19 came, no? And it unmasked a lot of the immediate needs of the health system, particularly in unifying our info system. We wanted a better epidemiologic surveillance in terms of contact tracing, hospital bed occupancy tracking, and also looking at the patterns of epidemiologic development, and also all these combined in a dashboard that aid interagency decisions. So it really pushed us to be more digital in a lot of our solutions, especially since we also, during COVID-19, a lot of our economy and also a lot of our activities are more remote na. No? So all these drove the adoption of digital health. Next slide, please. So just a bit of an explainer on how digital health is evolving within the Philippines. I don't want to delve too deep in this, but essentially back in 1998, the UP Manila introduced created the National Telehealth Center. And the National Telehealth Center provided ICT solutions on health, particularly teleconsultations in far-flung areas, in underserved areas of the Philippines. And to date, they have produced a range of e-health solutions, including telemedicine, e-records, telehealth, e-policy and advocacy, and also e-referral systems, those types of things, and also surveillance, e-surveillance. And these programs are still continuing on. And the National Telehealth Center have also moved partner with DOH to produce the National Telehealth Service Program. And the National Telehealth Center and the National Telehealth Service Program have paved the way to actually, for the Philippines to explore more deeply the e-health realm in terms of ICT solutions for health. And hence, the DOH and the DOST have also merged together with the ICT office to create the Philippine e-health strategic framework plan that will be implemented between 2014 to 2020. And it coincides with the e-government master plan in 2013 and 2016. So these things have molded the landscape for more e-health solutions to come in within the Philippines. And of course, this is further cemented by the UHC Act, because the law specifies that we have to adopt the national e-health program. And on the right of this particular slide, you see the emergence of a lot of applications that are now participating within the digital health landscape. Next slide, please. So on the broader context, like globally, digital health, and this involves the e-health solutions and additionally the more advanced computing systems, all of them are the emerging field of knowledge and practice associated with the development of technologies that will improve health. And in 2005, the World Health Assembly made sure that they advocated for a national e-health strategy, because they have raised that decision support systems through ICT-enabled decision support systems, and also a clearer medical records system or health record system allows better decision and facilitates and removes inefficiencies within the health system. Hence, the push for countries to actually advocate and create their own national e-health strategy. And towards 7 years forward, the International Telecommunications Union, together with the WHO, provided a toolkit for countries to actually formulate their own national e-health strategy. Next slide, please. Okay, so there are global frameworks that guide the adoption of digital health solutions or the e-health strategies or digital health. And in particular, there are certain ingredients. Of course, the health content. No, the health content in itself are the information that is aligned and recommended health practices and validated health content, and also the digital health intervention are the discrete functions of technology and the applications that are the softwares that actually are related with these interventions. All of them together needs a foundational layer of ICT and an enabling environment. And the WHO ITU components of the National e-health strategy point to 7 components, no? Leadership and governance, strategy and investment, legislative, policy and compliance, workforce, service, standards and interoperability, and the infrastructure. So the Philippines actually closely align their plan with this particular framework. And there are broader principles on how digital health can be adopted by various countries. So we have to make, they have forwarded principles that there has to be a full national decision and commitment, and solutions have to be integrated. It has to advocate for appropriate use that is trust-based and also ethical and also acceptable to people. And it has to prioritize the least developed, especially among areas that don't have necessarily the access to these ICT solutions or e-health solutions. There are also objectives that were put forward by the global strategy. And the Philippines actually follows closely these global frameworks. Next slide, please. So, anong naging implication nun? Now, the Philippines then try to look at their own set of solutions, and they have, in essence, created the technical working group and the steering committee that looks at the formulated the National e-health strategic plan. But within that, among the e-health solutions, they are forwarding a blueprint or the architecture that will guide the operations of the various e-health solutions that are emerging. No, dito makikita natin, no, in the parts of this particular slide, what we're looking at is that there has to be an open health information exchange component layer na nakikita natin dyan for the registries and also the open sources, and there also has to be a standard-based interoperability layer para magamit siya ng various users of the information or the external systems like the clinics, the hospitals, and the labs. And all of them are actually exchanging information. But there has to be system, there has to be a standard, there has to be a common language for this to happen. And of course, the infrastructure to actually build this whole architecture. Next slide, please. So now, as we move towards implementing the national e-health strategy, there are also various players that are not within that have not participated in that particular formulation of the strategy, but have put forth certain gains in terms of various digital health solutions. No, and in essence, in the Philippines, there have been further outreach in delivering quality care and sharing of individual patient information. So maganda yun. Actually, as Dr. Raj has highlighted, we need to increase the outreach for services. And at the same time, nagkaroon din ng support to health financing, and it has pushed further investments. No, it guided the various registries in health facility, the workforce, have guided investment planning, and also they have also systematized certain financing mechanisms like the PhilHealth claims. And in terms of health governance and management, the management information systems or the health information systems that have been provided by DOH and also various hospitals themselves have allowed the these small units and also the larger units to have better governance and management in health. And we also have a demonstration through the COVID-19 tracker and data dashboard in terms of improving interagency decision making. And of course, this expansion in the digital health space also expanded the private sector participation and other sector participation, putting forth mobile health apps, e-pharmacies, and also from other agencies, the EPAS. So ang daming nangyari as we evolved more into our digital health space. Next slide, please. So I'll try to finish with that. So we have a still persisting challenges, no? We are still unable to transition from analog practices. Mahirap. A lot of our localities are still doing antiquated means, no, paper-based, and then complementing it with just submission of the encoded material later on. The Philippine e-health strategic plan and the Philippine Health Information Exchange remain incomplete. Parang pipe dream, no? Kasi 2020 dapat natapos na siya, pero still it hasn't finished. And also most public sector ICT solutions still do not clearly translate to better patient and provider experience. We actually have more information sometimes from the from the private sector in showing how ICT solutions are improving patient experience. And we also understand that because there's a large disruption in the ways that our public facilities are working once we introduce ICT solutions. So sometimes, even with good intentions, it actually translates to worsening outcomes. Next slide, please. And of course, there are also harsh realities in the Philippines. The pervasive fragmentation in terms of disjointed care at saka digital divide. The people who are poor are not necessarily able to access the digital gains. And there's also difficult political realities for them to actually set up a broadband system. It needs congressional franchise. And also, we lack that level of technical leadership for our systems to actually progress. No, we need more technically able leaders in terms of ICT solutions at the local setting and also at the national setting. And the private sector investments are not necessarily clearly mapped out within the national strategic plan in e-health. So it's poorly leveraged on what public outcomes it's reacting to. And of course, we understand that a lot of the solutions are trial with LGUs and hence and hospitals, hence the local development actually becomes faster. And we wait for a lot of the developments at the national level that goes on a very glacial pace. So sometimes the upstream problems are pushed to the patients, the need for them to actually find their own internet connection, to actually have access to mobile technologies, which shouldn't be. And of course, and there's also poor support to innovation and prohibitive regulations. And these are the realities within the Philippines. And once we venture into advancing digital health within the country, we are also going to face several other challenges that are faced right now by other countries, like data breaches, cyber extortion, and of course, integration with their current work. Next slide, please. And highly intertwined with the solution to actually with the intention to increase digital health adoption, the Philippine digital economy has to continually increase, but adoption also has to happen. So adoption from the private sector, from the business sector, the government, and also the people have to be able to fully adopt a digital lifestyle. Even when we have increasing number of internet users, how they actually are able to facilitate economy is still not very clear, or is still not meaningfully done. And the digital divide is also present because there's limited digital infrastructure. Only 60% of our households actually have internet, and there's a high cost and slow speed of internet. Actually, ang Philippines halos kapantay niya ang presyo ng Singapore. But in here, you will see that the level of digital adoption of Singapore is actually much higher than the Philippines. Next slide, please. Okay, so what future do we see now? No, continually there will be a global push for digitalization, and we continually aspire for UHC, and also part of that is addressing the pandemic. And there's also rising supply and rising demand for digital solutions. Next slide, please. And what I predict now, next slide, sorry. What I predict now for the Philippine digital health is that there will be, within the next 10 to 15 years or 20 years, there will be more encouraging context. No? We will be able to refine our legal frames, and there will be higher digital literacy, and hopefully we are closer to achieving universal health coverage. But essentially, we know that local solutions will be faster than national solutions. We did a study on remote M&E, remote monitoring and evaluation practices. And what we've realized is that remote solutions will not fully replace face-to-face. And the same goes with care. And what I anticipate is there is a hybridization of care and health system management with expanding pockets of demonstration. So there will be some areas like provinces that will adopt a digitized primary care, some provinces that will have digital hospitals where there are the services are actually networked across, accessing various specialists with and bringing that particular set of talent or set of human technical capacity to the care of a patient. And there will be more available digital infrastructure. And in terms of demand, there will be more demand for better experience. Patients would now expect personalized care and ease of transaction and on-demand care. Providers will expect better clinical analytics because they don't have to sift through humongous amounts of information just to be able to say, am I doing good in my clinical practice? There will also be collaborative platforms where they share clinical guidelines quickly because evidence comes every second. And also managers will have clinical governance and also health management information systems that are more efficient in actually guiding decision. Next slide, please. I guess we can skip this particular slide and also the next. Basically, what I talk about there is how we can further participate in terms of the whole frame of collaboration for digital health. So there will be the Ministry of Health will have a brokering role so that international expertise and local actors will have interaction in setting the standards of interoperability for them to better deliver digital health enterprise or carry out the digital health enterprise. And lastly, my last slide. Second to the last slide. So in essence, there is enormous potential in digital health. And what we need to really look at is we need to catch up with infrastructure and catch up. And this catch up in infrastructure will actually increase inclusivity of our solutions because a lot of the people who are left behind are the people who don't have access to digital solutions. And also there has to be a whole of society approach. Considering that there has to be reliable sectors that will carry out the various aspects of this development. And there also has to be focus on people-centeredness, a real consumer transformation so that we build a digital foundation that enhances the participation of Filipinos in their own care. Last slide. So just to give something as a kind of a recommendation to the various actors in this particular webinar, we need to harness this zone of opportunity where there's an increasing use and increasing literacy. We need to overcome the disruption kasi disruptive na itong solution na to, no? This current development will disrupt the ways of how we work, but we need to be faithful in the approach. I've shown you the principles of the way that various countries have done it, and I think there's a lot of sense in it. And by keeping faithful to the approach, we will continue with our digital health development. At the immediate term, I think the private sector poses a lot of potential to actually increase our adoption and also adopt emerging and contemporary models of care. We are now seeing expansile systems, no? Yung biglang mawawala at lalaki, dadami ang number of bed capacity, and then we have to dwindle down again. So this is a new way of monitoring the needs of people. Digital hospitals and digital clinical education also have to emerge. But if we are going to push for universal healthcare, we need to prioritize these digital solutions within the primary care setting, the gates that are closest to the people, and especially among the marginalized. So in essence, all these complex processes should not steer us away from the desire of digital health solutions, that patients are well supported and informed, that health providers are actually best assisted in care, and also health organizations become smarter and more transparent and accountable for decision making. That's it, and thank you for listening.
Thank you, Doc Mikes, for that very insightful presentation. So, in short, there's a lot of work ahead of us to make digital healthcare more inclusive, more investments, more collaboration with the private sector.
You know, on one hand, you're encouraged by how far we've come. On the other hand, it's daunting to see na ang dami pang kailangan gawin. I don't know where to start. But we can start with the next session, which is the panel discussion. In this discussion, we will hear from our panelists about their reactions to Dr. Caampued's keynote, as well as their insights into what lies ahead in the healthcare sector post-pandemic.
Our first panelist is the founder and CEO of Reach 52, a social enterprise building a brand new community-driven healthcare service model to deliver healthcare services in low and middle-income countries, integrating public and private sector. Edward Duty has worked extensively in digital healthcare, patient and market access, insurance and health financing, business model innovation, and building multi-sectoral partnerships that create new healthcare service delivery approaches across developed health economies in Europe and now Asia and Africa. Prior to founding Reach 52, he worked for the UK National Health Service, one of the world's largest consulting and tech organizations, Capgemini, and for a large pharmaceutical company, Novartis. And he's a graduate of the London School of Economics. Welcome, Edward.
Hello, good afternoon, and thank you for having me.
Our next panelist is Karen Alparache Villanueva. She has over 30 years experience in communications and policy work in various industries: consumer, insurance, travel, and pharmaceuticals, the latter of which she spent the last 2 decades in. She earned her business administration degree from the University of the Philippines in Diliman. And in June 2015, she founded a health consultancy company, Health PRX, which aims to bring together the private and public sectors to partner for health. Her most recent corporate post was as External Affairs Director of MSD Philippines, handling communications, policy, commercial innovation, and market access. Her aspiration for her work, whether as patient advocate or communications consultant, is to be able to help realize the dream for every Filipino to have access to high-quality healthcare. Karen.
Thank you, Dax, and thank you, Inquirer, for including the patient perspective in this very important discussion. So PAPO is actually the umbrella organization of about 48 disease-specific patient groups in the Philippines. Thank you.
Our next panelist is Grace Anduiza. She has 18 years of experience in the telecom industry with stints in the different segments of the business: wireless, wireline, and ICT services. She is now focusing on business development, for the SME segment in her capacity as Chief Revenue Officer of Global Health Telecare Inc. and Konsulta MD, a subscription-based health service which is part of the Globe Telecom group of companies. Welcome, Grace.
Good afternoon. Hi, Doris. Hi, Dax. Thank you for having us. We really appreciate being part of a forum such as this because this is a way for us to reach more people, which is part of our aspiration at Konsulta MD.
Thank you, Grace. There you go. There's your presentation.
Okay. So let's start. Let's play the video, please.
I can't hear the audio.
Sayang, hindi natin nadinig yung audio.
Oo nga.
Baka pwede natin i-play.
Let's do that again.
Yes.
Oo.
And by the way, he is a real doctor.
Gwapo pa naman.
Okay.
We've had a lot of questions about Doc Kenji. So, medyo nag-disturb siguro sila sa kanya. Go, Doc Kenji.
They're sorting it out.
Okay.
So, saan siya doctor, Grace?
He's part of our...
Saan nagpa-practice?
He has his private practice, but he also practices with us. He's part of Konsulta MD also. Well, he's with us as part of our pool of doctors, of general practitioners who answer your calls. Kaya naku, makadadami ng tawag sa
Hahanapin ni Doris.
Kaya pala siya ang kinuha mong model for your video.
Sige, you know what? If it doesn't play, it's okay. We can just try it.
Okay, there you go.
Yes. Okay. Game.
They'll share it again.
Mukhang ayaw talaga.
Ayaw talaga.
So anyway, kinikwento lang naman ni Doc Kenji how simple it is to make use of Konsulta MD. Whenever you feel unwell, it's easy to reach our doctors because they're available.
To get started.
Oh, there.
Konsulta mo na yan.
I-consulta na lang daw. Naputo lang sinasabi ni Doc Kenji. But basically, all he's telling us is how simple it is to consult or to reach a doctor whenever you are unwell. So it's not like before that you have to leave your home, you have to travel all the way to a hospital or a clinic just for you to find out that, okay, a doctor will tell me that I have to take medication, I have to rest. So at least basically he's telling us that there are options. Next slide, please. Ayan. What do we do at Konsulta MD? We want to be at the forefront of the future of health tech. Konsulta MD is right now the largest telehealth company in the Philippines, and we provide 24/7 access to high-quality medical information through a team of licensed doctors. Kaya sinabi namin, totoong mga doctors silang lahat. Next slide, please. As mentioned earlier, you can reach our doctors 24/7. It's unlimited depending on the plan that you have subscribed to. And the best part about it is there's no appointment needed because you know naman, and I have experienced this on my own, how hard it can be to reach a doctor or to set an appointment because siguro madaming may sakit or hindi rin talaga enough yung doctors natin minsan. Next slide, please. Now, why do we do what we do? Because the Philippines really has a lot to improve when it comes to healthcare. Based nga doon sa presentation earlier, di ba? Makikita natin talaga how we still have a lot to work on para talagang we reach the level of healthcare where we want to be at. To share some statistics, in certain remote areas or in certain regions, the doctor to potential patient ratio is 1 to 33,000. Just imagine, diba? There's very limited access to doctors kasi ganun yung ratio. And the aspirational ratio is actually 1:1,000. So we're actively and really working hard on how we can bridge that gap by providing access that can link our doctors to more patients wherever they may be. Yan. Actually, people who us when we don't as a group, if we don't take care of our health issues, it actually has a lot of impact, not just to ourselves, our families, but also the nation. Yeah. Next slide, please. Part of the discussion is what has been happening pre-pandemic, post-pandemic, just to share some stats that we have gathered. In 2021, we have experienced a 2,000% growth in consultations versus pre-pandemic. Ang taas talaga. So it tells you that at least more and more people are getting comfortable in the use of telehealth platforms as compared to just relying on face-to-face. Of course, if there is a rise in consultations, what do we need to do? Next slide. That will show you that we continue to work in getting more partner doctors. So we have 1,600% increase in doctors on our platform. Para sigurado na pag tumawag kayo, meron kayo makakausap. Diba sabi nga natin, unlimited, no appointment needed, and it's 24/7. Next slide. Right now, as I mentioned earlier, we are the most visible telehealth consumer brand in the market. Our aspiration is to spread our message across the different segments to get them to try and be comfortable in adopting a hybrid approach in managing their health needs, be it face-to-face or through virtual consultations. Next slide. Ayan, so makikita ninyo, habang hindi pa nag-move yung slide, you'll see that right now we have 44 million views on TikTok, and I'll tell you what the views are about. And we are also endorsed by over 600 plus key opinion leaders, including Heart Evangelista and Kylie Versosa, as in they've also tried the service themselves. We have strategic partnerships with Huawei, and we also have nationwide merchandising through 7-Eleven, Robinson Supermarket. We've partnered with Pocari Sweat and Uniqlo, and these partnerships continue to grow. We also have 60 brand partnerships, including Lazada, Shopee, Kumu, and of course, for Globe. Alam nyo ba na pag Globe subscriber, if you're subscribed to G-Plan, you have Konsulta MD. All you have to do is download the app and register, and you already are covered with Konsulta MD. I bet madami sa inyo hindi pa alam yan, but now that you know, you can start downloading the app and making use of it. So, next slide, please. We are active across different social media platforms and brand partnerships. Why? So we can make use of these platforms of communication to get more people on board. Much as we try to, alam mo yun, even if we tell people through different, in several forums, it's still not enough to get them comfortable through this setup. So what we do is we make use of these different forms of communication platforms to get them on board in whatever platform they are comfortable with. Diba? So we can just browse through the different slides para makita nyo mga activities namin. Yes, for the past year, we have been very busy. Kasi nga ang aspiration namin is to get the message across to more people. Diba? Next slides. So yeah, just to show you, these are our partners. Or we partnered with Grab, TikTok, Pocari Sweat, yan, lahat yan. And we continue to build that partnership with different brands. Next slides, please. Ayan, we're also present on Viber. We have Zalora, Panda Pro, ayan, Zalora, lahat yan, we're present there. Next slide, please. Yan, yung na-mention natin kanina, we have key opinion leaders such as Heart. She really talked about Konsulta MD. Ano yan, hindi siya paid endorser by MD. Talagang, I think she really used the app, and I think she was very happy with the service that was provided, so she spoke about it. So yeah, true siya. We have other, hindi lang naman po tayo ang mga artista, pero alam naman kasi natin, the mga artistas have so much reach na if they start talking about us, then more people will at least try. Diba? And what's important is, if they try, then at least makikita natin na they are becoming more conscious about taking care of their health and not being limited in doing so. Next slide, please. Ayan, na-mention natin. Actually, we can browse through the next 2 slides quickly. Ito yung mga partners namin, the key opinion leaders, and overall combined, there are 314 million followers already. Why is this important? Because if people start talking about it, and then other people who are not comfortable or familiar in the use of telehealth platforms will at least give it a try. And mali mo, once they've tried it, they'll get used to it. And yung na-mention ko earlier, it's the hybrid approach to healthcare. It's not just limited to face-to-face anymore. Next slide. Ayan, we have medical partners. So if you're a Consulta MD member, you get discounts through our different partners like Monolastic Center, Metro Dental, Park and Swab, Polymed, and many more. Kasi nga, we are very busy in really partnering with more laboratories or even patient care that can be accessible to our members. Next slide. In retail, we have to be present. We see the need in being present in retail because a lot of people make use of these brands, and being partnered with these brands, it builds that conscious effort na parang, oh nga pala, there are options. And even if these brands are actually trusting Consulta MD to be a partner, na there are options for people to access doctors or for their medical needs. Next slide. Another slide, yeah. So we have partners in banking. Another slide, please. Insurance, FNCGs. Let's move to the next 2 slides na lang quickly. At least makikita nila. Ayan, ito yung mga FNCG partners namin. We have Tiny Buds, Period Party, United Home, Gardenia. Next slide. Rewards programs also. We partnered with rewards programs. Kasi diba with rewards programs, you gain points. So why not make use of some of these points to try out Consulta MD by subscribing to our different plans? Next. As I mentioned earlier, why do we focus our efforts on TikTok? Because we promote educational content. It's not just for commercial value or the commercial aspect of it, but we also focus our efforts in promoting healthcare through the different topics by means of segments that are hosted or participated on by our doctors and specialists that talk about different health issues that some people are either too shy to ask about or talk about, or about, just to even ask. So, yan, through these different forums, makikita nyo ang taas ng viewership on certain topics. Yan. Nilagay lang namin kung ano yung mga topics na talaga ang daming nanonood. Tapos even on the questions, ang daming nagtatanong about dandruff, the dangers of vaping. Yan. These are some of these are some of the efforts that we've been doing, and it's been working well. And hopefully we get more viewers para naman talagang people really find out that there is an alternative to just face-to-face, especially now that a lot of people are going back to work, that traffic is again back in business. So yeah, why not make use of a telehealth platform instead of just going through all that traffic for some of the basic health needs that you might want to talk to a doctor about. Next slide, please. Ayan, we also have live stream shows and different episodes, and we continue to advertise this through our Instagram page. So it would be nice if you could follow us through Instagram and our TikTok and also Kumu para makita niyo what are the different talks that our doctors are doing, and some might be helpful or it might be something that you might need at a particular time. Next slide. Ayan, as I've mentioned, we do have different focuses that our doctors talk about. And since May is Mental Health Month, we've really been focusing on the mental health aspect because a lot of people, even with businesses, one of the reasons for high attrition is actually mental health of some of their employees. So we've done an active effort in promoting mental health efforts that can help guide you towards taking that first step to consult a licensed psychologist. So here's Kylie to tell you more about it. Let's play the video, please.
2019, 11% of adults deal with depression and anxiety. 2021, that number has risen to 41%. 56% of adults aged 18 to 24 experience anxiety and depressive symptoms. In the Philippines, a study has shown that over the pandemic, 16.3% reported feeling a moderate to severe psychological impact. 28.8% reported moderate to severe anxiety symptoms, and 16.9% reported feeling moderate to severe depressive symptoms. Only 44% of those who suffer with mental health issues have received treatment or counseling. People are feeling more isolated more than ever as the pandemic keeps them away from their friends and family. It can be hard to find the help you need. Konsulta MD is your partner in overall health, both physical and mental, because we know that your mental health matters. Mental Health Matters aims to serve those who are in a dark place and bust the stigma around mental health. We want you to know that you matter, that your mental health matters, and that we are here to help. Seek help. Download the KMD app, talk to a professional, because we want to help. As of 2019,
okay na. Just what Kylie said, be kind to your mind, and your mental health does matter. And what our focus is to make everyone feel comfortable in taking that first step to consult about mental health. Next slide, please. But there are current barriers. There are barriers to seeking this support for mental health. Just some stats that the very simple stats that I'd like to share with you. 43% are interested in seeking mental health, but are unsure when to start. Should I start talking to a doctor? Is it right to talk to a doctor? Do I need it? Do I not need it? So all these things go through their mind. So why not make it simple by at least giving them access, easy access, diba? For them to at least take that first step. Also, there's the cost barrier. An average cost for a health consult with a licensed psychologist is about 1,000 to 7,000 pesos. And aside from that, it's the difficulty of getting an appointment with a licensed psychologist. And it's not like a pill that you swallow, diba, na one time. So you have to have several sessions. And just imagine if you have to travel or book a session with a psychologist, that's gonna take time. So why not make it easier? Yun ang parating iniisip namin eh. Why not make it easier for a potential patient para at least, diba, they take things better. Parang they will make use of it better. They won't take it for granted anymore. Kasi nga, ease of access is also important when it comes to healthcare. People take things for granted. Kasi parang ang hirap, matagal, mahirap. But here, what we're trying to do is to break down the barriers for not just taking care of our physical health, but also the barriers to taking care of our mental health. Next slide, please. Ayan, what makes it simple? You can talk to a licensed psychologist 24/7. It's on a paper consult, and that's equivalent to one video consult, and it's only for 600 pesos. You get access to e-medical certificates, psychotherapy, referrals. The psychologist can then refer you to a psychiatrist depending on the need. Diba? If you need to advance or to evolve into something higher as when you take care of your mental health, then you can talk to a psychiatrist. Next slide. And this is going to be my final slide. Why? Because I just wanted to show you how easy it is to get on board. So this is going to be a very short video, but I encourage everyone to please watch.
Hi, thank you for calling Konsulta MD. This is Dr. Tan speaking. May I know who's on the line, please?
Apparently nobody's on the line, but basically what we're trying to tell you is how simple it is to log into how simple it is to speak to a psychologist or any other doctor for that matter. All you have to do is download the Konsulta MD app through Apple Play Store, for Apple Store, Google Play Store, or the Huawei App Gallery. Once you've downloaded the app, all you have to do is register, input the voucher code that you have, and you can already start talking to a doctor. You can also fill up the consultation form. And if you see, there's a note there that says Inquirer Cares. So for everybody watching, or even our panel, if you'd like to make use of the free vouchers for mental health that we are giving out, all you have to do is download the app, register, input the voucher code Inquirer Cares, and now you can start making use of it. And it's straight. You go straight to a psychologist. So don't do it right away if you're not yet ready to talk to them right then and there. So yeah, yan siya. So that's how simple it is. So next slide. Let's work together. We're excited to partner with different organizations, different businesses. But the importance of that is how we can get the message across that it is simple and it is easy. And please do take that first step in having the courage to have a hybrid model. Aside from face-to-face, we also have the virtual consultations. Thank you.
Thank you, Grace. While you were giving that presentation, I just actually downloaded the app.
Thank you. And I would really encourage everybody to do the same. Ang dali, di ba? So
I am now about to create my profile right after this.
Hey, less than 5 minutes you can do that. So
Good.
thank you.
All right. So now let's begin our discussion. Okay, I want all our reactors to focus first on what Dr. Caampued said earlier about the lack of a broad national strategy with regarding to, well, digital healthcare, and using technology, and the fact that at the local level, some people are moving faster. The private sector, it's really what's the word for it? Fragmented, perhaps, and there could be a real threat that people will be going off in different directions. Can I poll your thoughts on this? Perhaps we can start with Dr. Yadav.
So digital health and telehealth are exciting technologies that we have to use. We can get the best services through these solutions, but whether we are going in different directions, and there could be national guidelines so that we can assure quality of services. So yes, these are exciting technologies, but they are relatively new, so the government has some role, but the government should not limit the expansion and usage of such technologies anywhere in the world, not just Philippines.
Thank you. Karen, your views, national oversight, guidelines, guiding principles versus fast-moving local strategies.
Well, first, allow me to talk about how the patient behavior changed during the pandemic, no? So I think we saw a lot of fear from the patients, and they avoided the health facilities. So this led us to embrace virtual care or telehealth or telecare. And I think there was no issue with respect to the urban cities. But as we talk about equity, we talk about digital divide, and therein lies the concern. No? If you don't have good internet connectivity, then you're not able to access virtual care, which is quite significant, because we see that even after the pandemic, the patient will no longer go back to simply a face-to-face consult. Patients have already embraced virtual care. And the other trend that I see, and I'm glad that Dr. Yadav talked about it, is self-care. Because when we talk about self-care, much of the responsibility has to rest on the patient. So the patient is not only a passive recipient of care, but the patient must be able to help manage their condition. And you can do this through health literacy, and also access to doctors through digital health and telecare. And I totally agree that within the local government units, many models of virtual care or telehealth have been developed. But I think the challenge is how to integrate this and also ensure that it feeds into the referral network. Because the vision under universal healthcare is every Filipino will be assigned to a primary healthcare provider or a GP. And we cannot go immediately to specialists, which is what's happening right now, right? So how do we then integrate these networks together? And the other concern that I see is in terms of the private sector. As you know, most of the healthcare is provided actually by the private sector, about 60%. So how do we integrate the private sector and the public sector so that they work with each other and be able to provide the care needed by patients? So back to you, Dax. I hope I answered the question.
Yes, you did. Grace, you are the private sector. You're at the cutting edge of this thing. I suppose you don't mind that you're practically making the rules as you go, no?
We have been actively, like I mentioned earlier, working with different partners on how we can bridge that gap, be it connectivity or actually getting it across. We've started working with different LGUs on how we can encourage some of their constituents to start taking that step or start working on, or parang we bring it to them instead of them going to the different facilities themselves. We do have projects where we bring some of our not the doctors themselves, but there are equipment or facilities that we can bring to the different regions, especially areas that are far flung, and then we provide the access by which after the testing, the basic testing that they can do, they're automatically linked to a doctor, and then they can make their consultation, and the doctors can also provide them with e-medical certificates or e-prescriptions that they will need. So we do continue to do this, and being in the private sector allows us to be flexible. Now we can work with private companies and also the government, diba? Private companies also kasi allows us to for better reach na some of their existing clients, we also get on board.
Edward, if I may modify the question slightly to take advantage of your international experience, is this something you see in other countries, other jurisdictions as well? The private sector running way ahead of the public sector, despite the absence of a broad national strategy?
Yeah, first of all, thanks for the invite. And yeah, well, my background is, I did work for a big pharmaceutical company in access to medicine in India. I then worked for the Department of Health in the UK. And now, here in the Philippines running Reach 52, although we've subsequently expanded to 4 more countries, biggest markets being India and Indonesia. I guess the 2 parts of the question, centralization versus decentralization. I think I worked out once that in India we need to get 1 permit, where in Philippines we need to get about 2,000 letters signed by LGUs. So I mean, it was that order of magnitude at least. So from a private sector point of view, or at least a third sector point of view, having a decentralized system, being close to the patient, local, in touch control is certainly valid. But the additional administration and potentially bureaucracy that comes with that is challenging. In the UK, we had a very interesting system whereby everything was centrally controlled, but the primary care physicians would effectively vote on how the budget was spent. So centrally managed, but with some level of say into the national decisions. So the national government had to act by listening to and getting votes from the primary sector physicians, which I thought was a fantastic model. In terms of private sector, moving fast ahead, I mean, I would say yes, that's probably quite true. India, Indonesia, which are actually our 2 biggest countries now, even though we started in the Philippines. Yeah, clearly Hello Doc, 1MG, these other large telehealth or e-pharmacy players are ahead of the government. So I would say it's a real thing in Asian health economies, that often it is the private sector that provides these services first and gives that patient experience, which has been touched upon a couple of times. and thus, gets traction. Although I would potentially argue that it's also a luxury of the rich versus a reality of the poor in all markets, because still a lot of these digital services, again, as have been said, touch richer people, not the poorer people, which is where Reach 52 focuses, very much the far-flung barangays, which perhaps I'll touch on later.
2,000 approvals. I'm embarrassed. Doris, over to you.
I remember we ran an article about Reach 52, about how you're bringing healthcare to the barrio. So Karen talked a bit earlier about how Filipinos' attitude toward healthcare has changed. So if you want to add to that later, Karen, you may do so. But maybe I'll ask Edward, because of your work in the grassroots, if you're seeing this change, any change in attitude among Filipinos, attitude in healthcare because of the pandemic.
Yeah, absolutely. And perhaps just to give a few words on what Reach 52 does, even though that doesn't directly answer the question. But we go to more rural, generally fully offline areas. We've built a tech platform based on Android, and we actually train the health workers, the barangay health workers and the equivalents in India. We're also in Kenya now, as well as Indonesia. So we just launched in Africa last year. But we train the health workers, and they basically collect data. And through having that data, we work with government and a range of sort of multilateral and private sector organizations to run more targeted campaigns. So have data, and then the health workers go to specific households with specific interventions that are run by both public and private sector. And then we also look to make access to affordable medicines and insurance, which again can come from government stocks if available. If not, we would supplement it with a sort of private sector marketplace where we look to get discounted or affordable medicines from our partners. Started in the Philippines, now 3 or 4 more markets. We've got about 10,000 health workers that work with us at the moment, and about 1 million patients a month that access our services. So not huge, but grown. Has health seeking increased? I'm actually in Iloilo at the moment. I've spent the morning in Caampued with one of the doctors there. And I think the reality is that when all the health resources were focused on COVID-19, there was a complete lack of support for anything else. So the municipal health officer I've been with today is saying, we couldn't support hypertension and diabetes and stuff like this. It was all about contact tracing and COVID vaccines and all the stuff we know about. So I think there was a demand for health services, and the supply, clearly wasn't there. From our data, we do think about this a lot. It's insane. I mean, the demand for nutrition, vitamins is absolutely through the roof. So I'd say there's been a demand for health and well-being services for sure. And we've seen that through, people requesting like nutritional products and other, broader things. Really interesting things now that we're seeing, and we were doing with this doctor earlier again, he was saying now that they're doing the COVID-19 vaccines, they're also integrating it with hypertension and diabetes screening, and they're finding loads of cases. So while they've got people in the right place, add other screening, and you are definitely finding other health issues for sure. So I guess overall, I would say yes, there has been an increase in demand and arguably a lack of supply in terms of the more rural sectors' health-seeking behavior.
Yeah, Karen, Grace, maybe can you add to that insights on how, especially in the countryside, how fast are they embracing digitalization during a pandemic?
The reason why I remember I showed you earlier that we've been very active in some of the partnerships or even the marketing campaigns are being visible across the different communications platforms, including TikTok. Some people might wonder why TikTok, because it's a medium that a lot of people are familiar with, diba? We're trying to really explore the different angles and how we can get more people on board. Kasi that's how you get them started, diba? If I am familiar with TikTok, then that's fine. We'll reach you through TikTok. If it's Viber, then we will reach you through Viber. So we don't limit ourselves. Na parang we continue to explore other means by which to reach the different groups or organizations and different demographics. You want to reach the youth, then you make use of platforms that they are comfortable or platforms that they like. If you want to reach the older population, then you reach them to the platform that they are used to. Diba? Facebook, for example, that's for the older, not naman older, I want to say that, for the slightly, sige na, older na rin, na population, they're more comfortable with Facebook. Then we reach them through Facebook. Diba? So yun, that's why, and the partnerships that we've had, partnerships or brands that are available regionally, and we partner with them. Bakit? Because people make use of these brands, and if we associate ourselves with them, then at least there's going to be that parang effort and consciousness that will build na, oh, this is available, or oh, let me try this out. Yun lang yun eh. You really have to induce trials and let more people appreciate that. Oh, it's simple. Yun naman, di ba? With most innovations, it's always that fear of, or parang people are scared na it might be difficult, I might make a mistake. But once you let them try it, then it should be all okay. I hope that, right?
Yeah.
Yeah, Doris, if I may hijack your stories, your questions for Dr. Yadav and Dr. Caampued, regarding the technology side of healthcare, telemedicine, digital pharmacies, and all that, do you see this from a policy perspective? Do you see this continuing, the use of this continuing way into the future, or is electronic health services a temporary phenomenon, perhaps brought about by the restrictions of the pandemic, right? Because you can't go to your clinic, you need to use technology. But do you see this going on long after this, or will we revert to the old practices? Perhaps Dr. Yadav first.
So digital engagement is here to stay, whether we are seeking healthcare or doing meetings or even doing schooling. So it's not going to go away. Yes, there are certain things we can't do on digital platforms like patient examination, but many things can be done. And even if a large proportion of patients may not be able to access digital solutions yet because of lack of proper internet connectivity, but even if, let's say, 10%, 20% of the population accesses it, that will reduce the pressure on the health workers, because then they can pay more attention to the people who cannot access through the digital platform. So digital platforms are not yet for everyone, but it can help significant number of people. In developed countries, of course, we see that for some specialties, digital health is the go-to for their issues. But even here in the Philippines, having video chat with a doctor may require more bandwidth in the internet, but sharing lab results or longer term follow-up using digital tools like in TB care or hypertension care, that requires lesser bandwidth, and we have to harness these digital solutions and help even the poorest of poor, although video calls may be an issue for some, at least for a few months or years. Thank you.
Dr. Caampued?
Yeah, just to also correct, there is a whole framework, e-health framework that that the Philippines has. What we're having is that elusiveness for it to actually fully happen. So that's the problem right now, and I think it's inevitable that digitalization will continue. So it's almost a natural movement now, as we see the evolving values of people, as we want more person-centered care, but we also want unified standards and unified approaches and efficient systems. The only way that you can actually marry that is to actually harness digital gains. Another thing is that that global imperative. the Philippines is a very, what do you call this? Masunurin. What's the English term for that? And they are very,
Compliant, Dr. Mike.
Compliant, yeah. Philippines is a very compliant country to international commitments. And part of the international commitments where the globe actually recognizes a more interconnected health system. And this is the direction to go. And as that global pressure is present and also the individual pressure is present, naturally we'll have to adapt to that.
Dax, I just wanted to say that the other value that digital health can bring is addressing issues of transparency and governance. So we need to be able to put in place electronic medical records that protect the patient's privacy, but at the same time ensure transparency in the system so that whatever, for example, PhilHealth pays out, the claims are legitimate and they are based on the proper documentation, issues as well in terms of procurement. These are very, very important issues because without digitalization, then there's no way that we can monitor and track usage. And this is so important with primary healthcare because if we're going to roll it out to the 110 million Filipinos, if we do not have a digital system in place, a digital infrastructure, then there will be a lot of leakages and issues in terms of corruption and governance issues.
Basically, Karen, what you're saying is it's an effective tool, but it's not a silver bullet, this whole digital technology thing. Okay, I've just been informed that we should go on a quick break. Thank you for sharing your thoughts on us. We will be back with one more round of questions. For those watching, if you have questions, feel free to send them in and we will ask our panelists to answer them for you. Before we continue the next part of the program, we will have a quick break. Stay tuned for more. Hang in there, guys.
The Philippine Daily Inquirer would like to thank the following sponsors for making this live stream event possible. Globe. Konsulta MD. Ikonsulta mo na yan. MaxiCare. Live your best life. Medicard. Prescribed by doctors. We'd also like to thank Inquirer.net, Mega Mobile, and Inquirer Academy. We'd also like to acknowledge the organizations that have partnered with us. Thank you to
Have you been feeling unwell lately? It is important that you talk to a doctor immediately and have yourself checked. Don't just brush it off because we're here to give you medical advice immediately. Skip the line with Fast Pass. Talk to a doctor immediately for only 500 pesos. Guaranteed fast or your money back. We got you. Whether it's day or night, we're here 24/7. Kaya, konsulta mo na yan! Oh, hello, good afternoon. This is Dr. Fajardo speaking. How may I help you today?
I want to be like Mama when I grow up. Mama says learning can take us from where we are to where we can be. It can change us from who we are to who we can be. That in teaching minds, we also end up teaching hearts. Thank you for taking care of Mama Mina so that she can inspire more people to do more.
Aside from training, I also make sure I do physical therapy regularly to smoothen out any tension in my body, in the muscles, to avoid injury. What I like about MaxiCare is that they are accepted in all major hospitals and clinics around the country. They also have a MaxiCare Primary Care Center when you need a checkup. And they also have a dedicated wellness and rehab center for people like me.
Dr. Yadav will have to leave shortly, so he'll have to deliver his closing message earlier than the rest. Dr. Yadav.
Wala pa yata.
Oh.
Is he still around?
Oh, Dr. Yadav has left. So we begin with our final round of questions. I'd like to start with Dr. Mike. So after as we shift from pandemic to endemic management, diba? In NCR, the vaccination rate is already high, but yung effectivity of the vaccines will lapse in 6 months or a year, depending on what vaccine you've taken. So how do we see us moving forward? Especially where we'll have a change in administration and maybe change in strategy.
With relation to digital health or as
oh
as
no,
a whole?
in general. I was gonna ask Dr. Yadav, but maybe you can share your thoughts. Kasi the post-pandemic management, diba?
Yeah. So I think it's quite early to actually try to surmise a post-pandemic management. What we can say is new pandemic ways of living. That we are more aware of our health status individually and also of the community. Because I think what it has taught us is our safety is only as good as the health of our neighbor, right? So we have to be more aware community-wise and also individual as an individual. And also, I think one of the major things that will change is, well, apart from all the things that have already been said, the architectural change that has to happen to actually allow distancing and all that, is the change in our activities has to be seamless now. I think we've learned a lot already for us to actually behave like this is all new. We already know how to react to a pandemic, and I think the fundamentals are already there. Minimum public health standards, self-care, and also risk, identifying a risk-based approach to managing communities and also ourselves. Yeah, basically that's it. Very, very basic things we've learned, yeah.
Okay, thank you. Edward, if I may ask, your focus is clearly on the lower and middle income segments of society in bringing them healthcare. From the perspective of someone like myself who covers business, is this a sustainable business from a healthcare standpoint? Are there profits to be made, or is this social enterprise a something you're doing just for the good of everyone?
I think, well, personal aspirations are probably the latter. It is definitely for social impact for myself, yeah. But in terms of, is there a business in lower middle income communities? It's a growing segment. I mean, it's almost like saying, is there a business in telehealth 10 years ago? Well, not right then, but you're sort of assuming the world will become more digital and consumers will want more digital services, i.e. the market grows from a relatively low baseline. If you consider, so I think, yes, there is profits to be made in the future. The sort of key parts to that is Asia is getting wealthier, GDP growth is going up. We are in one of the highest growth regions, in Southeast Asia on the planet. Consumers are getting, wealthier. They want better services. So the purchasing power today is not going to be the same, in 5 and 10 years' time. And I think for Region 52's business model is having a single revenue stream as possible. So we're just an e-pharmacy and we make money on medicines. Absolutely not. That would just not work as a business model. So I think what we've really had to master is we have an agent or a health worker in a community. They can serve their community. And there's a number of different things they do right from the start. So you end up with, multiple revenue line items, multiple value propositions to different organizations. We have worked with, UNICEF and Save the Children in the Philippines. So obviously your traditional grants, but we also work with more than half of the world's largest pharmaceutical companies, big consumer health companies, big insurers. So yeah, I guess the sort of tip is diversification of revenue, as well as just building the sector over the next 5 to 10 years in a way is how I'd argue that.
More power to you then.
We have a question. We have a question here from our partner institution, Philippine Disaster Resilience Foundation. Maybe Karen can answer from the patient-consumer perspective. Which pandemic practices, innovations should healthcare providers retain in the new normal? And conversely, which practices will they cease?
I think healthcare providers should be able to provide teleconsultation, right? That's already going to be a given. What practices should they stop? They should stop making patients wait.
Making us
yes.
Yeah.
I think healthcare providers should be able to use digital tools. For example, creating appointments that patients can make themselves, right? So that we don't need to wait hours for the doctors to come, which is the usual practice before the pandemic. And we started going back to the clinics that continued. Also, I think it's also the way they relate to patients. As earlier, I talked about self-care and putting the responsibility on patients. It's healthcare providers working in partnership with the patients, allowing them to take charge of managing their conditions, and helping educate them on self-care and how they can improve their management of their conditions. So I think those are some of the practices that will need to happen post-pandemic.
Thank you.
Grace, forgive me if I keep asking about the business side because it's just so fascinating to me. But how does an outfit like Konsulta MD compete with individual medical practitioners who do their own telehealth consultations via Facebook and all these platforms? And they were quite popular at the peak, at the height of the pandemic. Right? But here you are, you have a structure. How do you compete against those guys?
Sometimes it's better to collaborate than compete, di ba? What we can do is forge or start working on partnerships para we can serve the needs of the people better. Diba? Sometimes it's no longer about business. It's just, it's not about that. It's really getting healthcare at the prime, making healthcare important to everybody and making it accessible to everyone and affordable to most people para it's easier for them or they can just, log in. So instead of, that's why I mentioned earlier, diba? We forge partnerships and the partnerships is not limited. We're very flexible. So we partner with NGOs and we also partner with different doctors in offering them the opportunity to make use of our platform so they have an option aside from the face-to-face, and it's gonna be easier because we're established as a healthcare telemedicine or telehealth service, so they won't have to go through all all those ICT requirements or telco requirements that they would need. They can just partner with us.
Okay, that's good to know.
Advantage to collaboration.
Good to know. Good to know. Okay, we're almost out of time, and we still have to hear from our last speaker, Dr. Manuel Dayrit. But before we go to him, we'd like to hear some parting messages from all our participants today. Okay, see, Raj left already.
Maybe Doc Mike's.
Okay.
Maybe hear your closing remarks.
Yes. So thank you again for this opportunity. I think, as we all know, and hopefully we've convinced that digitalization is a future direction. And just to add to what Edward and also Dax has been alluding to, whether this is going to be a worthy venture for anyone, I think that it points to, let's look at where our values lie. A society that cohesively says that better health outcomes should be incentivized will make these solutions profitable for anyone. For as long as individuals will have to pay for their services, that would be very difficult. But if we have systems that will allow better payments for populations that become healthier, then efficiency of service like digitalization will be rewarding for the whole society. So I think we have a niche and we have to identify that within the whole framework of digital health economies. Thank you.
Thank you, Dr. Caampued. Now let's hear from Edward and his drive to reach the fringes of society.
I was thinking about this today. I as someone lost 10 kilos earlier on their weight loss journey, I think I lost about 13, and I've subsequently put most of it back on. So but as we know, pandemic preparedness, being fit, being healthy, not having comorbidities, and so on, it's really important. So I think it's the age of public health and wellness. As I say, we saw lots of demand for vitamins, which I didn't add, is now going down, that the pandemic subsides. So I think my parting words would be, I hope we take future pandemic preparedness seriously and really embed public health and prevention, and making sure people are fit and healthy should really be at the heart of that, would be what I think, beyond just the digital component, which obviously I'm a believer in.
Thank you, Edward. Now let's hear it from Karen.
Thank you. We're in a unique situation where we can transform the health system so that it can be more patient or people-centered. We need to give the patient more voice in terms of health policy making. We need to bridge the digital divide so the poor can access virtual care. We need to equip and incentivize healthcare providers so they can provide virtual care. And finally, invest more resources in health and build the capacity of the healthcare providers, the whole healthcare ecosystem to deliver care, which is people-centered, equitable, affordable, and of good quality. Thank you.
Thank you, Karen. Okay, now let's hear from Grace, possibly the country's next unicorn venture.
That puts a lot of pressure on me, no? But it's the way I'm approaching it is, it's not just from a business perspective, but it's becoming more of an advocacy for me. The more people I get on board, the more people, people who were hesitant to go to the clinics or the hospitals to get that consultation, all they have to do is to pick up a phone and just make that call or log on to your video and start talking to a doctor. And I just wanted to share with everybody that we are working very hard at Konsulta MD to make sure that we bridge that gap. We want to bridge that gap to provide access to everyone, for the patients to have that link to their doctors, so they can start being conscious in taking care of their health better. I, for one, I can say I'm at fault when it comes to that. But sometimes I always make that excuse that I don't have the time, I'm too busy. But now I don't have an excuse, because all I have to do is pick up my phone and log on to the video and start consulting a doctor. And we're also trying, and at Konsulta MD, we're also trying to make it simple. Ang hirap, di ba? May sakit ka na nga, maghihirapan ka pa to book an appointment, and right now all you have to do is pick up a call and make that first consult, and that's all it takes, di ba? So there, i-consulta mo na. Ang saya sabihin, but baka kailangan gawin niyo na yun. Subukan niyo na, i-consulta niyo na. Just download the app, try it out. Thank you.
Thank you, Grace. And now to close our session for today, we have invited Dr. Manuel Dayrit to share his take on what lies ahead post-pandemic. He has been a public health practitioner for 45 years. He has worked in the public, private, NGO, international sectors, as well as in the academe. He served as Secretary of Health, World Health Organization Director, and Dean of a medical school. And he led the country's efforts to contain SARS in 2003. As one of the country's leading epidemiologists, he is active in the COVID-19 control efforts through private sector engagement with the national government and local government units. And he continues to teach and do research as an adjunct professor at the Ateneo de Manila, Ateneo University School of Medicine and Public Health. He remains passionate about seeing the country achieve health for all Filipinos.
Hello. I'm grateful for this opportunity to speak to you briefly on the question posed by Inquirer Rebound. What lies ahead post-pandemic? Here are some points to consider. First, we must ensure a better state of preparedness of the country against future pandemics and other threats. The pandemic allowed our public health system to make rapid improvements over the last 2 years in pandemic control functions. This includes for disease surveillance, laboratories, hospital capacities, and IT-enabled services. For example, before the pandemic, Quezon City had 7 persons doing disease surveillance. At the height of the pandemic, this number had exploded to 2,000 people, counting surveillance nurses, contact tracers, and encoders. Most, if not all of these people, were contractuals and so-called job order personnel. As the pandemic recedes, Quezon City is having to decide what proportion of its built-up capacity will be prudent to retain on a permanent basis. Many LGUs are in this same situation. The Department of Health successfully improved the way it collected and analyzed information for COVID. This secured the daily reports that they provided to media. It will be wise to continue to improve this system. The goal is a real-time, IT-powered surveillance system covering the country for all types of diseases with epidemic potential. Second, learning lessons from the pandemic response, we must strive to improve health governance on an ongoing basis to improve basic services for all Filipinos. We must do this at all levels of our health system, national government and local government. We must do this across sectors, the public sector and the private sector working together. This will entail new ways of working. The Universal Healthcare Law of 2019 declares ambitious goals for improving the healthcare of Filipinos. But when you look closely, these goals can only be achieved with innovative governance mechanisms. For example, PhilHealth's Konsulta package, which seeks to widen primary care benefits, is beginning to be rolled out. New networks of health providers are being accredited by PhilHealth. Targeted beneficiaries are being enrolled. These innovations are welcome and groundbreaking. But will they work? We will know in a couple of years. Within the public sector, we have to find ways of working more seamlessly in the decentralized system. Our response to the pandemic has shown that local governments can function better in synergistic relationship with national government. And national government can govern better with the support and cooperation of local governments. Third, combine better governance with increased investments in health to ensure basic services for Filipinos. When our country's health expenditures are compared with ASEAN neighbors, we are judged to be lagging behind. This is the basis for the argument that investments in health should be increased. However, the call to increase health investments must be preceded by good governance. Increasing investments when governance is poor will only waste resources. Our country should be increasing investments to ensure that basic healthcare is available to all Filipinos in an equitable manner. We might anticipate that future debates in Congress will focus on spending more to build tertiary specialized hospitals in urban areas in various parts of the country. But I would argue, and I am not alone in this argument, that building specialized hospitals without ensuring that basic services are met will mean that we undermine the goals of universal healthcare. More specialized hospitals are not the solution to the lack of basic health services for the great majority of Filipinos. If we go this route, what will happen is this. Millions will continue to go without basic care, and those who actually seek it will bypass the poorly equipped, poorly staffed, poorly financed primary healthcare facilities. They will go and congest the specialized hospitals. This results in poor health provision across the board. This is the very situation we must reverse. Finally, we must marshal battalions of our health workers to work in our health system. Health workers are our country's national treasure. They are guardians of our health. The pandemic showed us how important it is to have motivated, skilled, and properly supported health workers of all types to serve in our health system. We need bedside nurses as well as medical scientists, barangay health workers as well as clinicians, lab workers as well as epidemiologists. Ensuring a reliable pipeline of health workers properly trained and practice ready for service to country is a major undertaking. The pipeline starts at the health professional schools, where students are formed to be competent and motivated to serve. The work continues in the institutions that hire them and nurture them throughout their careers. Policies which attract and retain health workers in our health system will be of crucial importance in this highly competitive, globalized world, where jobs in foreign countries will continue to lure them. To conclude, 2 takeaways to answer the question, what lies ahead post-pandemic? 1, ensure pandemic preparedness through fundamental public health interventions nationwide, including IT-powered public health services. And two, ensure that Filipinos get the basic health services that they deserve. The UHC law already mandates these two priorities. Let us get these priorities done. Thank you.
Dayrit, and thank you for continuing to champion public health. There's so much more we want to discuss, but that's all the time we have for this INQUIRER Project Rebound webinar. Once again, thank you so much to our speakers and panelists for sharing with us their valuable insights.
Thank you to our viewers, and we hope those of you who joined us learned a thing or two. Thank you to everyone for being a part of the INQUIRER Project Rebound webinar series presented by the Philippine Daily Inquirer.
We'd also like to thank INQUIRE.net, Mega Mobile, and INQUIRE Academy. Continue reading the Philippine Daily Inquirer for authoritative news and features. Once again, I am Doris Dumlao-Abadilla, INQUIRER Business Features Editor.
And I am Dax Lucas of INQUIRER Business. Thank you for joining us and enjoy the rest of your day.
The Philippine Daily Inquirer would like to thank the following sponsors for making this live stream event possible. Globe. Konsulta MD. Ikonsulta mo na yan. MaxiCare. Live your best life. Medicard. Prescribed by doctors. We'd also like to thank INQUIRE.net, Mega Mobile, and INQUIRE Academy. We'd also like to acknowledge the organizations that have partnered with us. Thank you to
Ang hirap ng malayo sa pamilya. Pero kinaya namin. Kailangan strong kami as a family. Kasi nung nawala si Mama, all we have left is each other. Hindi ko man sila laging kasama, alam ko na okay sila. Parang andun pa rin ako. Thank you for taking care of them.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.